Welcome to my podcast. Today I'm going to talk about another common case. I just read an update about it. So basically, after you introduce yourself and double check the patient name and date of birth, you'll ask, how can I help you today? So it might be women in any age group. She might say that having asymmetry of the boobs, or maybe she has noticed a lump, or maybe she thinks that her boobies are lumpy. In that condition, you will ask her, can you tell me more? If you have any concern, if you have any thoughts, what might be the reason? And if there is any thought about anything that you have, and you just try to address basically her concern. So basically, after that, you will ask, since when you notice this, if there is any discharge, if there is any symptom, if there is any pain, if there is any redness, if you have any history of trauma, a recent one or old one, and if they feel like sensitive at certain time, around, for instance, the period time, and you need to check if her age, which age group does it fit in, and if there is any family history with a similar complaint, and if there is any past medical history worth knowing, if there is any history of cancer previously or history in the family. And also you need to ask about medication and any non-allergy. So this article stated that certain women, they have dense breasts, which could be a risk factor for breast cancer, and it could reduce the sensitivity of the mammogram, which we all know that's been run in the UK as a screening tool. And I mean by that, it could mask any potential cancer because of the white background of the dense tissue, which could mask a white lesion, basically, which could imply early cancer. So any woman with a dense breast could undergo supplementary breast screening, and I mean by that ultrasound or MRI to increase detection. However, it might have a potential for harms and cost. And I mean by that, it's overdiagnosed or false negative or false positive. So in that regard, it won't serve its purpose. And additionally, the MRI is not funded for such an indication. And also, it doesn't routinely those kind of screening to record a dense breast or notify women about this, which could basically just incur excessive anxiety and confusion to women. So basically, breast density is a mammography-based measurement, which is done by the radiologist for the amount of the glandular and fibrous tissue comparatively to the fatty tissue in the breast. And it always varies from one woman to another, and also in the same woman over a lifetime. So say, for instance, in childbearing age, the glandular and fibrous tissue is mainly, and then it will transit gradually to the fat replaced after menopause. So lower breast density, it's usually associated and indicate that there is a previous history of pregnancy, breastfeeding, older age, and also obesity. There is 4 categories for breast density, which starting from A to D. So it's A, B, C, D. A, which means less density, which means fatty mostly, and D, which is mostly dense and it's heterogeneous. And B and C, it's in between, which is basically dense fibrous tissue. So any woman with dense breast are at higher risk of breast cancer by 4.7 times comparatively to other women who are less dense. And this has been found in a study that is similar to familial history of primary degree relative with risk of 3.8 times comparing to other women. However, with all of that being said, there is no consensus how to communicate this to women, and the GPs are not prepared to discuss this. So basically, from this concept, it's something you have to bear in mind and to have some knowledge about that women with dense or can be called lumpy breast, they could be more inclined for, God forbid, breast cancer. And therefore, in this kind of situation, it's preferably to discuss that just with the women, say, for instance, it seems that you are more of this one dense tissue. You have more dense tissue, and it could be firm, could be lumpy, this kind of thing. And this will give the woman the choice if she wants to pursue it further, and you take it from there. So by that, I hope that I covered the dilemma of more breast density and what could this link to if something goes wrong. Thank you.